knowing there may be a few more people coming in, but I think we can get rolling. So I'll start. My name is Adam Rosa with Collabo. We're the planning coordinators for the West Ward Choice Neighborhood Plan. So we've been working with the community over the last 14 months or so to begin to develop the framework for the vision and the strategies that are going to go into the plan. I will pass it over to Andrea.
Hello, everybody. It is my pleasure to be here with you guys today. Thanks for joining us. My name is Andrea Gonzalez. I am assisting Adam as a part of Collabo, and you guys have probably seen me around in the neighborhood because I have been working very closely with the Westward community doing the needs assessment. And without further ado, I will pass it to Tanya.
Morning, everyone. My name is Tanya Ruiz. I'm the assistant manager for the Westward Community Initiative, and I'm also a Westward resident, so I'm super excited to be here. Thanks.
Awesome. Why don't we go next to Rosemary?
Hi, everyone. I'm Rosemary Lister. I'm the Senior Network Director at Community Health at St. Luke's University Health Network, and I'm excited to be here. I've been working a lot with Ryan lately, so it's good to see him again, and been working with Paul and Two Rivers over the years, and excited to be part of this.
Great. Thanks for being here. Why don't we go next to Ryan?
Hello, good morning, everyone. I was just recently introduced to this initiative from Amy Bacadora. We're working on a event with Rosemary as well up at Blue Mountain to bring a number of residents from West Ward up and do some snow tubing. So really looking forward to that. I'm most famously known to be flipping hamburgers with Dan Bonaham at the National Night Out. So I'm excited to be here today. My family was born and raised in Easton, and just look forward to this.
Awesome.
Thank you.
Yeah, we missed your burgers. We were at the National Night Out, but we were working a meeting, so we didn't get over there. But I did hear about the Blue Mountain event. That sounds really cool. I actually told Amy she needs to take some footage of herself going down on an inner tube, down the tubing hill.
Yeah,
So,
I spoke to her yesterday. I don't know if she's gonna be there. I tried to pressure her a little bit.
Yeah.
Okay. All right.
A couple of people in the working group yesterday were talking about her into it as well, and there she is. Amy, do you want to say hello?
Morning, everybody. Amy Bacadoro from the Westward Community Initiative. Sorry, I forgot I walked home last night and left my car in the garage. So that was a fun realization this morning. So I apologize for being a little late.
No problem. Thanks for being here. All right, let's go next over to Dan, please.
It's actually Andy Osetnik. I'm just using Dan's computer from the Easton Police Department, and this is my first meeting.
Thanks for being here, Andy.
Yep.
Let's go to Paul next, please.
Good morning. I'm looking forward to this meeting today. I'm Paul Brunswick with Two Rivers Health and Wellness Foundation, and I do hear that Ryan makes a mean hamburger.
Awesome. All right, next let's go to Kathy, please.
Hi, I'm Kathy Trimble from Pinebrook Family Answers. Paul had asked if I would be willing to come to this meeting or this committee, and so it's my first meeting. Pinebrook, for those of you that don't know, is a community-based organization, nonprofit here in the Lehigh Valley. We have offices in Allentown, Easton, and Wind Gap. They're outpatient behavioral health clinics in each of those locations. And then we have a number of community-based programs and also some mental health programs. We are in 12 schools with school-based counseling, including Cheston Elementary. And that's been a program that's been very successful for us, meeting the needs of youth with mental health needs in the school so that the care can be given right there. And we also have a pretty successful program in Allentown, our mental health liaison with the Allentown Police Department, where we have 3 counselors, social workers embedded in the police force and trying to divert crimes that shouldn't necessarily lead to arrest, mental health crimes or mental health incidents, that we can work with them and then provide ongoing case management. So I'm excited to hear about Easton. We've been in the Two Rivers building for a long time, which is where our Easton clinic is. And we're really committed to the Easton community.
Well, thanks for being here, Kathy. Appreciate you. All right, let's go next to Nate, please.
Hey, good morning, everybody. My name's Nate Boateng. I'm with the Leonard Parker Poole Institute for Health, which was formerly the Dorothy Ryder Poole Healthcare Trust. We were invited by Jared Mass to sort of sit in on these meetings. We're a civic organization focused on, addressing social determinants of health at the neighborhood level. And so excited to hear what's going on and excited to be here. Thanks.
Awesome. Well, thank you all for being here. And I know we have some newcomers on the line, so I'll give you just a real brief overview of what you signed up for. So we have been working with the West Ward community over the last 14 months to develop what's called a choice neighborhood transformation plan. And this is a program that comes from the U.S. Department of Housing and Urban Development, and it's really their place-based initiative to really doing a few different things. It's focused on revitalizing distressed public housing sites, but it does it in the centerpiece of a larger neighborhood improvement effort. So it's founded on really 3 different pillars: people, housing, and neighborhoods. So we have our housing authority properties within the West Ward, which are really our kind of our target housing sites for this initiative. But we're essentially taking a look at the entire West Ward community and developing a neighborhood transformation plan that will help residents really connect opportunities and make the community a healthier and more livable place. So we have the ability. So we're a little bit over halfway through our planning grant, which is a grant that we received from HUD. Our plan is due in December of this year. And once we have it completed, we can then apply for what's called a implementation grant, which could be anywhere from, right now it's up to $40 to $50 million to start to rebuild the housing, put a lot of these programs in place, build physical neighborhood improvements that kind of tie it all together. So that's really our ultimate goal, but along the way, we're really trying to develop a plan that can be implemented with or without that additional grant funding down the road. So we've been spending much of the last year doing community engagement, especially with the Housing Authority residents of North Union Street property, the Bushkill House, which is a senior and disabled property, and then the Elm Street apartments, which are on the south side of the West Ward. So we've been doing a lot of kind of targeted engagement with the residents there. Andrea mentioned a survey that we conducted of all of the residents of the 3 housing sites. But then we've been doing larger community meetings as well to really try to reach the wider West Ward neighborhood. So we're now at the stage in our project where we are developing the strategies and really the actions that are going to go into the plan. And the way that we're doing that is through the organization of these 5 different working groups that you can see on the screen. So we have housing and business, transportation and open space. This is the community health and safety group. We had equity and inclusion that met yesterday. And then we have art, history, and culture that's going to meet tomorrow. So each of these groups is building off of a vision, kind of a vision illustration that was created at a large community meeting that we had it was actually the National Night Out. You might have seen us there. We had a huge poster up against the side of Paxenosa Elementary School. We were capturing all this feedback. And that was really the jumping off point for these working groups. So I'll go through a little bit of what we've heard so far, what we developed. We also have some of the key takeaways from our needs assessment survey down here at the bottom. So we're kind of constantly reflecting on that as well. And really, so these working groups they're a 3-stage process overall. The first stage was really a brainstorming where you can see all these yellow sticky notes all over this poster here. That all came out of our first meeting about a month ago. So we've taken all of these notes and we've tried to really list out 10 potential community health projects, 10 potential safety and security related projects. So on today's meeting, we're going to have you all really vote and prioritize those projects in order of importance from your perspective. The third meeting that we'll hold in March, we'll take the top 3 or 4 projects from each of those 2 different topic areas, and we'll kind of get down into the weeds a little bit on those, and we'll start to think about who the partners can be to implement them, what resources might be available to make them happen. So a lot of this is about connecting the dots between different organizations and partners. There may be things that your organization is doing that we don't know about, or other organizations on the call don't know about. So this is also about sharing information together. So I'm going to just give a kind of a quick overview of where we left off at the second meeting here, and you can see it all on the screen. So starting kind of at the top left corner, we're talking about, so this is health and safety. And they kind of, the 2 things tend to bleed together a little bit. But the idea of enhanced street lighting, building off of some of the improvements that have happened on Northampton around lighting. It was something that was brought up. A grocery store is kind of a key ingredient that we hear very often in terms of community health and neighborhood amenities, classes, adult education. How do we encourage healthy food? And then we kind of got into pop-up clinics and talking a little bit more about the health resources that are in the neighborhood or in close proximity. We talked about safety and security, the fact that crime is generally going down, but the impression is still that the West Ward is maybe not the safest neighborhood in town. So thinking about how do we promote the fact that it's becoming safer, and how do we continue to kind of implement safety improvements. Somebody was talking about it, there's a perception I'm not driving through the West Ward, that kind of thing. Talking about specific areas like the playground on Union Street. One of the residents mentioned they feel unsafe there. Overall, I think people would like to see more police, more foot patrols, programs, so sports programs. How do we kind of increase the number of health-based initiatives that are fun for people to be involved in? Then we have kind of the physical infrastructure that's also has to do with safety. So sidewalks and potholes and walkability. People talked about the community restorative center, kind of a brick and mortar place to foster cohesion and community. We talked about building trust with both police and healthcare, and kind of community policing, and how do we strengthen that. Alternative healthcare programs like acupuncture, yoga, better access to that. Outdoor fitness programs that could be utilized. And transportation to get people to services. It's something we've heard in all of the working groups so far. So there's a lot here. And like I said, what we tried to do was kind of filter this down into a set of projects that we can start to think about ranking and prioritizing. But before I go on, just want to open it up in case there's any questions or any comments that anybody may have before we get going.
Adam, can you show the bottom of that map a little bit? I didn't get to really look in on that feedback.
Is that good, Rosemary? And we can also share the link to this so you can zoom around on your own. But let me see if I can put the link in the chat here.
Great, thank you.
I got you, Adam. Just a second.
I think I got it. All right. So let's move on here. So we are now going to do a little polling, and there's a few different ways you can do this. So I will bring it up. Let me copy the link again. Bear with me 1 second. Okay, so we're using a site called Mentimeter, and there's really 3 ways that you can utilize the site. So basically, you can either open it up in a new tab. If you're on your computer, you can pull it up on your phone. I just added the link to the chat. You can just click on that, and it should take you to the polling. I'm also going to invite you to. Let me see here. You can add Mentimeter to your Zoom, and that's the second link I just sent. Or you can go to menti.com and put in the code 7194-3110. So I'll give everyone just a second to do that. And what you should see, I'm going to share my screen here. So you should see a question up on the screen. And if you're getting ready to vote, there's a series of little drop-down menus. So as soon as you click the first one, it'll give you a list of all 10 projects. And you can pick from 1 to 10, 1 being the highest priority, 10 being the lowest from your perspective. So I'm going to walk through each of these, and then as I'm doing that, you can feel free to jump in there and start to rank and vote. So the first idea, so the question is, how would you rank the following community health strategies in terms of priority? The first would be a grocery store recruitment, either traditional or a cooperative model, which would be like a community-based grocery. The second would be a corner market healthy food program, where we're really trying to work with the local corner stores, bodegas, that kind of thing, to bring healthy food. The third would be book distribution partnership at the little free libraries that we're installing, that we have installed in the community, but really trying to lean into that. These are probably going to shuffle as I go through because people are voting. The next would be expanded community sports programs in the West Ward. And we know that there, with the improvements at Cottingham Stadium, there could be more opportunity for that kind of thing. There's other park improvements that we want to do in the near and short and long term. The next would be improving access to existing programs. So it was talked about adult literacy, healthcare for all, et cetera. We may not be reaching all the residents of the West Ward that are in need of these programs. The next would be a liaison with the Bushkill House and other senior sites for health services. This was brought up as an idea in our last working group. Next project idea is free or low cost mental health services. And I think in the introductions that was brought up again as something that's offered at one of the local elementary schools, but it seems like there could be a need for that neighborhood wide. Next would be affordable daycare and after school programs. Next is outdoor fitness programs. So like the Tai Chi or yoga classes in the parks. And the last, I think, is the pop-up health clinics that could be it's probably something that has been happening over the last 2 years with COVID vaccinations and that kind of thing, but really trying to find more opportunities to bring healthcare to different corners of the neighborhood. So I see 3 people have voted so far. We'll give you guys a few more minutes to kind of think through these 10, and then we will have a discussion about the top ranked programs. So go ahead and vote. If you have any trouble, let us know. Or if you aren't able to do the Mentimeter, you can put your top programs in the chat as well.
Adam, I have no idea how to do this.
Andy, are you able to pull it up on your phone at all?
Let me try it.
It might be easier. If you can just go to menti.com that you see on the top there, you should just be able to punch in that code.
Okay.
That might be the easiest way to do it.
I got it.
Cool. So yeah, you should just see the drop down menu. You can just pick them one by one in order of
Okay.
importance. We'll give you a couple minutes.
You gonna be down in the range tomorrow? Jeff will.
All right, well, it looks like we had 8 people vote, so thank you for doing that. The top programs, top projects that were identified by the group. Number 1, free and low cost mental health services. Number 2, corner market healthy food program. Number 3, improving access to existing programs, adult literacy, healthcare for all, etc. So we are now going to open it up for discussion around those 3 topics. So I put them on the screen here. I'd really like to get everyone's feedback on kind of why they voted the way they did. Really, any thoughts you might have on the particular strategy and how we can start to kind of detail it out. So the first is free or low-cost mental health services. And I know we, during the introduction, we were talking about, Kathy was talking about some of the programs that they have in some of the local schools. And, maybe Kathy, you can get us started. Tell us a little bit more about that and what you think we can do neighborhood-wide in the West Ward to allow people to access some of these types of programs.
Yeah, they are, there's research that shows that youth who receive their services within the schools are more likely to continue with the services because it allows them to access them immediately when it's needed. Our counselors work with the blanking on the name. Is it SAP team or a team in the school, and they can be referred, and they can be referred, and it's sometimes just a couple sessions because they've had some sort of incident, or it can be long-term trauma. The counselors also then do like family counseling and counseling outside of the school. So it's pretty comprehensive in that instead of it being a session-based, you go to a session and you bill it to your insurance. These are funded by a variety of funders. The United Way is actually who funds the counselor in Cheston. The Bethlehem School District has actually gotten some grants, used some of their Recovery Act money, different things, and they have a ton of counselors in their schools. And it's just a method that, because these are just like full-time employees and they're just dedicated to the school that they serve, that they kind of meet the family's needs and the children's needs. So we've seen that. And as I said, I can also send the group, we kind of have a one-pager that shows some outcomes and a little bit about the program. I can see if I can pull it up and drop it in the chat too. But it's a very successful and kind of a growth area for us, just in that the need is there and everybody's starting to realize it was big before the pandemic, but the isolation and the stressors that these families, because it's not only the child's mental health, generally, a lot of times there's mental health issues with the whole family, or a parent because of different factors, either due to the pandemic, economics, physical health, trauma. So it's really a great program.
I'm just curious, is it offered at Paxinosa or anywhere else in the West?
It is not.
Yeah. So I'm sorry, go ahead, Kathy.
No, that's fine. Yeah, go ahead.
I was going to say different schools have different partners that provide those mental health services. So St. Luke's does provide those services at Paxinosa.
Okay.
And also at 7 of the schools in Easton. So I have that listing of them, but the program for St. Luke's is called YES. It's school-based therapy. It stands for Your Emotional Strength Supported. So it's YESS. And so it's I can email it to you separately, but it's at Paxinosa, Shawnee, Palmer, Forks, March, Tracy, and Cheston. Although Kathy, did you say Cheston?
We're in Cheston as well.
So I'm wondering, how can there be 2 in Cheston? Or maybe I thought there could only be 1, but maybe.
Yeah, I'm not sure if the YES program is slightly different, because I think what ends up happening with our counselors is they also do some case management. So I don't know if
Okay.
yours is
Yeah, I know.
strictly,
Yeah, I think ours are strictly, I can find out, but I know it's LCSWs in the school.
yeah. So ours are probably not LCSWs. It's probably a more economical options. I mean, they're counselors and, you know,
Yeah.
they're able to, you know, but they, you know, they do sessions and it doesn't have to, it can be 5 minutes, it can be 40 minutes, it can be,
Gotcha.
I broke up with my boyfriend and I'm having normal, you know, teenage angst, or I just need a respite from, you know, get out of the, you know, a friendly face. You know, while they are, you know, therapists, but they also kind of take on a broader role. And
Excellent.
as I said, I would imagine it's probably more economical than LCSWs because I know how much LCSWs can command.
Right. Although it is sustainable because it's a reimbursable program. So
Right.
they are able to bill and, but it sounds like both are excellent. And one other thing you might want to add is at Paxenosa, it works with the community school model, which is an evidence-based model.
So do you think there's a challenge with either getting young people comfortable enough to use the services? Or I know Kathy, you mentioned having the parents involved in kind of a wraparound mental health
Mhm.
care services through the schools. How can those programs be strengthened going forward?
Yeah, I mean, I think, and the interesting thing is we all know with mental health services, you know, the parents need to consent to treatment for their children. Although they're at a certain age, I think in the high school, they don't have to, the students can consent themselves. But I think that the idea that of facilitating like family meetings really addresses the community wide health. And that's why our therapists have the ability, because they're not getting reimbursed through Medicaid or other insurances, they do have the ability to go out into the homes and meet with family, you know, like take the services to them if that's the way that we're going to get it done. So it's just a little different model because of the reimbursements and everything.
Mm-hmm.
And then having, you know, part of the problem with like in our clinic, because in our clinic, we see, I was just doing the numbers this morning for a grant, about 63% of the population that we serve is considered to be youth, which is under 24. It's about 40, 60. And, you know, part of the problems too is the access to services. I mean, we have only so many appointments that are after school or at night when people can actually, you know, people that are working, you know, hourly jobs can't say, oh, I need to take an hour off because I need to go to my doctor's appointment or whatever. So that creates a, you know, a crisis, you know, in terms of a wait list, because by the time you get them in for, you know, those coveted, and I mean, our clinics are open until 8 o'clock at night on Saturdays. And we do, you know, one of them even, I know they have clients on Sundays, but it's very limited. And that's where the school-based comes into play, because you're taking a huge chunk out of the population and they can get them while they're in school.
Yeah. Thanks for sharing that. And I see there's a note in the chat from Ryan talking about advertising services on social media, YouTube, first responders, ensuring there's not a stigma with people receiving health. I feel like I've been seeing more commercials related to mental health services online, but I don't know if that's just me or if that's a new thing overall.
I will say that some of us are
Adam?
part of the Northampton Suicide Task Force, and they did have a messaging campaign. They work with the school partners. We had the goal to reduce suicide by 20% by, I think it was 2019. We did see a drop, but there's a lot of collective impact going on with that task force, with messaging, reducing stigma. They had, I think it was 10 master trainers trained for Northampton County to do question, persuade, refer. And they've been out there, they each have to do a certain amount of trainings. So training lay people, training people at some of our nonprofit organizations, in our schools. We just had another school in Northampton County where all the staff was just trained in QPR. So there are some strategies, evidence-based strategies like that, as far as reducing stigma and getting that messaging out.
Absolutely. All right, let's move on to talking about the Corner Market Healthy Food Program. And I know this is something that's been relatively successful in other places. And I believe that there has been discussion in Easton about establishing this type of program, but not, so I'm just curious, hearing from the group here, why do we think it's important? Do you think it's a good way to get healthy food into the neighborhoods? And what are some of the challenges associated with this?
Adam?
Yes, go ahead, Paul.
Yeah, I think it's important. I think the last session, we talked about the fact that just because of the way the West Ward is laid out, it's really very difficult to even think about having a regular grocery store. There's no parking, the sites, that type of thing. So the corner stores that traditionally, handled like snacks and so on, with Kellen and Nurture Nature, the buy fresh, buy local markets have been working with corner stores to get produce and vegetables, fruits. And it's kind of the old day. If we can't, the same with the mobile market. If they can't get to the store, if there's no store there, then we got to get the food to them. So it's a matter of, and I know that they're working hard to get all the SNAP benefits, various programs into the corner stores, but it's kind of a tough sell, just because of the ownership of the stores. But they have been working hard on it.
Mm-hmm.
Adam, if I could make a comment on the Kellen as well.
Yeah.
Over the past year, our office is fairly new. We've been in existence for a year, Office of Community Engagement. And one of the venues I found to be very beneficial, one for the community and two for police officers, is working with Kellen. So partner with Eric, I'll go in the, whether it be a morning or afternoon, set up with one of their mobile food markets and say, all right, Eric, I'm gonna hit the beat. And I'll just walk and talk to people for the duration of the time they're there. And, the first impression that I get as a police officer in uniform is, why are you talking to me? it's kind of funny to some degree, but it's not. And then you start talking to whomever you're speaking to, and you're like, hey, listen, I just want to tell you about this mobile food market that's down the road here, and there's a grant program, and you can get free food. And I shop from them, and the food is really good. And so just in like talking to Eric and being throughout Easton, Allentown, and Bethlehem, there's a level of the population that's transient at times. And I mean, they'll go from Easton to Allentown to Bethlehem. So I think the benefit of the mobile food market and having somebody who's willing to walk around and engage the community's wallet set up is very good, because they may not know about it, even if they live 2 blocks down. and you'll get things like, "Oh, really? Like like it's right down the road. Come on with me." And then they get there, and then they get the free food, and then maybe they spend a couple bucks, on some healthy food in addition. And then, in my opinion, like, you got them. You know what I mean? Like, they know it's there. They know when it's there. You engage with the community as a member of the community. The whole police and community barrier that we run into at times, you break some of that because everybody needs food. And I found a lot of success in the Kellen Foundation and being able to provide healthy decisions for people. But you gotta be willing to walk and engage the community, talk to them.
Yep.
There's some infrastructure in place too with Kellen, because one of the problems with the corner stores and getting healthy food is, how do they get it? So Kellen is out visiting local farmers, picking up the stuff they need for their mobile market, but they're also now delivering it to the corner stores at an affordable price where they're not paying a huge amount for delivery and that type of thing. It's going to take time. It's not going to happen overnight. They've been working very hard at it, both Nurture Nature, the Buy Fresh, Buy Local, and Kellen. So I think it's started. It's just going to take a while.
Yeah. I think what you mentioned about getting the owners on board, and then also building awareness so people know that they can go down to the corner store and find healthy food. I think both of those things are really important to the success of that program. So yeah, I'm kind of interested in learning more about it. We'll try to reach out to them and see what we can potentially include in the plan that would help to promote that program going forward.
I think also in other community meetings, and also with talking with Eric at Kellen, who we partner with them on a grant program in Easton, and also we host the mobile market in our parking lot in Allentown once a week, is the corner store initiative. The owners, they don't necessarily have the, you want to get produce into them, and they don't have the coolers and the space. And, I think they're hesitant about having this, type of food. So as you said, as Paul said, infrastructure delivering, but infrastructure in terms of supporting these corner stores so they can provide that type of food.
Yeah, I know my little corner market in Chicago, they're always shuffling things around to try to fit more inventory in there. And I could see that being a challenge, especially if they're not set up for that. Andrea, do you have a thought you want to share?
Yes, thank you, Adam, and thanks everybody for your input. Do you guys think that there's also probably a gap in information? Because I don't know if this is statewide, but in some other areas of Pennsylvania, SNAP benefits get doubled if they are buying like fresh food and vegetables, and maybe just like the residents or they are just unaware that this could be a good thing for them, and they are just not taking advantage of it. And then also, do you guys think that there's also another gap in education where residents don't buy the food because they don't know how to prepare like dishes with those like other foods that they wouldn't normally get? And these are just questions.
That's a really good point. Buy fresh, buy local, which is Nurture Nature. That's what they're doing, and we do fund them. They are out trying to do that publicity about the benefits that are available, when the various benefits that you can pick up through the WIC program, SNAP, double SNAP, all kinds of programs. So there's a big effort going on in that right now from a publicity standpoint. And from the other point she made is excellent also, and that is that some people are just not used to you know, the different kinds of recipes and cooking that you can do with the fruit, vegetables, and so on. And Kellum will do that in their in the mobile market spots. You know, kids will look, say, I'm never going to eat that. Then it looks terrible, but when they eat it, they love it. So it's progressing, but those are two really good points she raised.
So I am having an idea, Paul, and everybody. I don't know if this could possibly take off, but kind of like overlapping yesterday's meeting about equity and inclusion and other groups that we have brainstormed about, like creating inclusive environments for diverse cultures, like perhaps having a community kitchen or an outdoor community cooking event, because it helps build community, and then like people take home whatever they learned to cook today, and it's a way that they can start getting exposure to like all these new foods or different foods that they wouldn't be cooking every day. Maybe just program it in the monthly event calendar at the Future Hub.
So Andrea, just to add to that, Carolyn Serga, who's the family center director at Paxanosa, she has an international food pantry, and we were able to visit it, and it was really great. And since they made it more international, it's been well received. So I'm going to send her an email, because one of the questions that we didn't ask was if she's working with Kellen or any of the local farmers and to get fresh produce in as part of that. And that might be interesting to know, because again, at Paxanosa, that's a great hub of the community where you have students, you have staff, you have families, and maybe that can be built off of as well.
I
think
love it.
a lot
Thank
of
you.
that comes down to storage and being able to maintain food. You know, their pantry is open once or twice a month, so to have produce there, if you can't store it, it becomes a bit of an issue. We have been doing fresh produce bags on a weekly basis at Paxanosa that we're giving out to the community, and that has a mix of veggies in there, a really rotating mix, but we do intend to pull back from that once the outdoor farmers market starts in June. So that's, I mean, it's that addition to Paxanosa, and their pantry was a really great piece, because they were finding, you know, things like instant potatoes were not eaten by Spanish families. So the ability to expand upon that was really helpful and get things that were more culturally acceptable.
Nice. Well, we can get Ryan at the outdoor farmers market to cook up some recipes for everybody on the grill, right? Using fresh food.
I only work with Dan, so if you get Dan on board, I'm there.
I would love to see a community kitchen at a community center, though. When we went down to Tech Centro, that was one of the pieces that grew out of their original Hispanic Cultural Center, was because, you know, there's such an amazing cooking culture, and people did that and shared recipes and produced things too. It was a really great way to bring the community together, both teaching, but also in a way to make some money too, and sell what they're cooking. So it was a really neat initiative, and I think that could travel far in a community center.
Absolutely. All right, so the last strategy was improving access to existing programs. And I know we've kind of touched on some of this already in terms of building awareness, but do you think that there's other avenues that we can pursue to provide more access? I know what we've talked about in the last group of equity and inclusion was trying to create community hubs or community centers where we're bringing services to the neighborhood rather than having people have to figure out how to get on a bus to go somewhere to receive some of these services. And we talked about the new farmers market as potentially being a hub for that type of kind of partnership and outreach, so people can have a better understanding of what's available. But I'd love to hear other thoughts on improving access and in terms of what we can potentially include into the plan.
This may have come up at our last meeting, and I even went back over the recording and I couldn't really pick up on it, Rosemary, but what about the medical vans, the health vans coming in to say like the Bushkill House area and the 7th Street apartments or Elm Street? I know that they have, you've had the dental vans, mammography vans, general health service vans. Is there a way that we can bring the health services into some of these assisted living areas that we're targeting?
So we might be able to do that. We could certainly look into it. And I think between the health networks and Melissa's health center, maybe there's ways
Right.
even to have it where providers go to the actual location, even without the van, and maybe, or even have community health workers there sometimes to consistently connect. I think it's definitely worth exploring. I know we had a shortage of van drivers, but we seem to be getting back to a little bit of normalcy as far as that goes. But you're right, the dental van used to go to certain locations, and we do have the medical van, so definitely options we can look into.
Yeah,
Well, especially when you look at the percentage of people that don't drive, and with the seniors and that type of thing, even getting to like I know they bring the a mammography van to the health center there at 1101 building, but still for some people that's a long walk, and if there's no bus access, it just
Yeah.
seems it would make sense to bring it to them, bring
So,
the vans to them.
So, good morning. Is it unfrozen? Can you hear me?
Yes.
I'm sorry. I have been frozen most of this call, and it keeps cutting off exactly when I want to hear. So I'm so sorry if it seems like I'm non-responsive, but and of course it cut off right at the senior center thing, Paul. So I apologize. So good morning. Number one, for those particular needs, we often, for example, we will often bring someone in like on it with an Uber Health, because we have an Uber Health account, just to let people here know, and for you, Paul, as well, like because the Mammo van can't like go to other sites, we will often arrange for the patient or person to be brought to the Mammo van for those kinds of special services. But in terms of collaborating with any other health partner or entity, we will always look to see if there's a way for us to like how can we better serve a community site or agency or entity, if there's a way to work with them. I know that we just signed on with the mill, across from Cheston, that they're opening this spring to help promote health and access. And they're going to have like a community kitchen in there, which I thought was quite interesting. The community health nurse and me got all excited with, they're going to have a bike room and a children's room and a kitchen and social services and stuff like that for the families living there. And I thought, oh, why isn't there something like this in the West Ward? But that's what I was thinking in terms of, I think that something like that, model like that would work beautifully. There was one in New Mexico when you were talking about the kitchen, Amy, that they had there, and they had a farmer's market and a kitchen and a cook that would come in, and they were able to also make things that they would sell. So it was really kind of cool. So yeah, if there are needs that come out of this, that, there are resources that are needed, we can put forth that and work with whoever.
Yeah, thanks for sharing that, Melissa. And I'm also curious about the comment in the chat where you're talking about the pandemic actually allowed you to access more patients through technology than you would normally. I'm just curious.
Yeah, we weren't allowed to do telemedicine prior. Like, I mean, we could have done it, right? We wouldn't have gotten paid for it. As an FQ, that was not within our scope. And so telemedicine and emergency orders actually allowed us and gave us permission to offer those services and actually get reimbursed for them. So we stood those services up and started providing them. And we actually were concerned because we didn't think our patients were going to accept that or have the technology for it, right?
Sure.
And so we were really surprised at how welcoming our behavioral health patients were, and more patients. And actually, we were one of the health centers that benefited from telemedicine. We were one of the health centers that actually got as high as almost 50% of our visits were telemedicine for a good minute there. Other health centers went back to in-person. And, you know, I know our area had higher rates of pandemic for a while there. So than other areas of the state. And so, you know, it just was prudent to keep the rates of infection down. But our behavioral health visits were astronomical for a while there. We had, you know, a no-show rate for the first time in our health center. Overall, our no-show rate was below 10% for a good set of months. And that really was because of the telemedicine services. You know, because families didn't have to worry about transportation or daycare or, you know, any of those things. And even the working families have commented to me like, you know, I'd rather come in or, you know, virtually because I don't have to wait in the waiting room. Like, you know, like I could just, you know, I could keep about my day and then you guys let me know when you're ready for me. So it actually worked out, and you know, the patients continue to benefit from having access to the telemed. So we, as an entity and across the state and country, have really lobbied that they not take away, because they actually consider taking away telemedicine from the community health centers after, you know, when the pandemic started to settle down. And we've had to very much advocate that they not take that away, especially for the rural health centers. The video and even the audio, right? Because people that live in the rural areas, you know, they don't have good access to Wi-Fi all the time. And so even out there, sometimes, you know, they would just have to be able to do, you know, telephone visits.
Yeah.
You know, so yeah, no, it really made a really positive difference for the population that we serve. It really, really improved access.
That's great to hear and really interesting as well, because we always talk about the digital divide and how that affects families. But it sounds like it's actually allowed you to reach more people
Yes.
in the last couple of years. So thank you for sharing that.
I just
I want-
wanted to jump
Yep.
into,
Go ahead.
I agree with Melissa. And a lot of it in the beginning was the learning curve of getting the clients to figure out how
Yeah.
this was all going to work. And they have embraced it. Although we do have more and more, especially with kids, telehealth doesn't really, you know, you can't do play therapy with, you know, via telehealth. But I also wanted to, I messaged our head of our school base to kind of clarify the differences between the YES program. And I know that Rosemary jumped off, but they have the licensed therapists, and they float in the schools. So they're not in the same school all day, every day.
Okay.
Whereas our concept is they're not really Pine Brook. I mean, they are Pine Brook people. And the reason they have to be Pine Brook people is for the supervision aspect and the legal, you know, the licensing and all that kind of stuff. But they're actually more members of the school community. And so they do have greater flexibility and also have no barriers in terms of no insurance. Like if, you know, a family doesn't have Medicaid or an insurance, which you know, for all the press, you'd think everybody does, but they don't. And so they have that ability to serve anyone.
Yeah.
And as I said before, go out into the home or into the community to work with students, because, and also like do class, like they get called in and they'll do like classroom observations. A teacher will want them to kind of just observe the behavior of a child before kind of maybe initiating them into treatment or sessions. So those are the differences between those two programs, both of which have value, obviously.
Yeah. Thanks for the clarification.
You know, another thing, as far as improving access and getting back into the mental health services, the kids are in school. And as a funder, you know, I think about 75% of our funding dollars go to adolescent programs, either for mentoring or behavioral health, that type of thing. But I'm thinking about the seniors that are in some of this assisted living area. Kathy, is there, and that may not have access, that don't have, and I think the survey showed it's a lot of them don't have access to internet and that type of thing.
Yeah.
Right.
Is there
So
a way?
that's something that we have been talking about with the United Way, because in their next funding cycle, they are very focused on seniors.
Okay.
And they always have supported seniors, you know, continuing to live safely in their homes. But there are a lot of discussions going on about the need for mental health services for seniors. One of the, you know, yes, they don't have technology, so it would need to be someone going in and working with them. And we do that to some extent in our home care program a little bit. Not like a counselor goes in, but we're aware of issues. But with the senior population, there's still that stigma, you know, they haven't quite gotten to, you know, you talk with them about depression, and, you know, even primary care doctors will say, like, they you know, with seniors, they talk about it and they're like, no, I don't need, you know, I don't need counseling. You know, it's just still a generational gap.
Mm-hmm.
You know, Paul, in terms of the seniors, you know, during the pandemic, we were playing bingo via Zoom. So we used the Zoom technology for the senior high rises. So we were doing bingo and social groups and chair yoga to help support their mental health and decrease social isolation. And that actually seemed to work, so that they could spread out like in the big rooms, you know, with their masks on, or we would help promote that if they could get you know, most of them at least had a smartphone, so they could at least connect with the Zoom. Somebody would help them learn how to at least connect through the Zoom and get it on their smartphone so that they could.
That's great.
Interesting. Well, I'm going to move us forward. We want to talk about safety. We have about 25 minutes left in the meeting. So we're going to do the same thing. We're going to vote on 10 different, I think we got 10 different potential safety projects. And I see some people have already put in their vote, which is cool. But so the question is, how would you rank the following safety strategies in terms of priority? These are all ideas that came out of our working group or came from the community. So the first is additional police foot patrols. And so you can just vote from the same link that you used last time on this. And let me know if you have any trouble. The first is additional police foot patrols in the neighborhood. The second is really the promotion of the West Ward as a safe community, really trying to promote the fact that crime has been going down and that the community is getting safer overall. The third is improved community policing through our community affairs officer. And so that was something that was brought up, that it's actually happening, and there could be additional things, that programs that get done through the officer, the street light improvements in the community, block watch captain program, education on gun safety, a walkability survey and focused sidewalk improvements, expanded local reentry programs, conflict de-escalation training, and then finally we had the idea of just more tree and bush trimming in the neighborhood to, especially in areas where they're covering the lights and making it difficult for visibility. So we have a whole range of different ideas and strategies here, and we'd love you to take a few minutes and think about prioritizing these from your perspective.
Adam,
Yes, go ahead.
could you could you put the link in the chat again? When I guess when I disconnected again, it didn't come back in through the chat when I
Sure.
reconnected. Thank you. I don't think I've had such technology issues in I don't know how long. I guess I look forward to this too much.
Hey, we
So,
all have
like-
these days. Okay, you should have it in the chat now.
Yeah, thank you.
You're welcome.
Oh, no, the community health one came back.
If you go to the next, you should be able to advance to the next slide.
Oh,
Unless
okay.
you're already voted on that. Or if you're already voted, you should be able to go to the next one.
Oh, okay. Oh, yep. Okay, thank you.
I'm having the same issue. I don't, it's maybe because I'm on my
You just
phone.
hit submit and then that's what I did.
You're just seeing the last poll?
Yes.
And you can't flip to the next slide?
I can't either.
If you, it depends on if you had, I did the same thing. I re-clicked on the Menti and it opened it up again and it went back to the beginning. But if you look, if you still have the old one open and you click on that, it'll go to the second one.
Hmm.
And if for some reason it's just not working at all, you can go ahead and put your top 3 in the chat, and that'll help us do the ranking as well.
I put the link again on the chat if it works. Hopefully it works for everybody.
Thank you.
I guess it's above my pay grade.
All right, well, it looks like we've had at least 5 people able to take the poll, so that should be able to get us started on the conversation. Looks like we have a tie for number 1, and that's streetlight improvements and additional police foot patrols. Number 2 looks like promotion of the West Ward as a safe community. And number 3 would be a walkability survey and focused sidewalk improvements. So let's brainstorm on that a little bit. 1 second here. So let's start with street lighting improvements. We heard at the last meeting that there have been improvements on Northampton Street that have been positively received and seem to be making the area safer and better lit. So I'm just curious why we think that that's still an important strategy, and if there's certain areas of the neighborhood that need to be focused on. Anyone have thoughts on lighting, street lighting?
Bad guys don't like the dark. So if you light things up, I think you're taking a step in a positive direction, and it's welcoming. I mean, people like to walk in areas that are lit up. I think it's just a welcoming atmosphere.
And Ryan,
People also feel safer.
Yeah,
You know,
absolutely.
you talk about perceived danger, but just walking on a well-lit street, you're like, okay, or even if you're going to park your car somewhere, you're like, oh, it's well lit, no one can.
And do you think it's, so usually there's 2 different issues with street lighting. One is that there are lights, they're just not on, they don't work. And then number 2 is there needs to be additional lights installed. So I'm just curious, which do we think is the bigger issue here?
Well, sometimes there's a third issue, which is there might be lights, like sometimes I'm in Easton and at night, like, you know, even like around the health center area, there are lights, but they're dim. I've had, you know, staff that, you know, they may have had to park a little bit away. And, you know, they say they'll unlock their car door and they turn around and someone's standing right next to them. And, you know, they've been startled. Now, you know, most of my staff are women, so, you know, they get a little nervous. You know, I've always talked to them about going out from all the health centers, right? Go out together. You know, it's not like they feel like it's an unsafe neighborhood. It's just that it's startling. And there's lots of areas in the West Ward where it's just a little more dim. It's not necessarily that there aren't lights or that they're not working. They're just more dim. I don't know. It's hard to explain. Like they're more yellowy or uh,
They're not
yeah.
the new LED kind of
Right. or-
bright bulbs. Yeah.
Yeah.
Amy, did you have a thought on that?
Yeah, I agree with Melissa. So much of the street lighting is tall street lighting and, made for vehicles. So it towers above, and depending on where tree coverage is, it gets caught in that as well. I mean, pretty much every street corner, there's a light, and then on your alleyways or, kind of half mid block or so, there's another light, but they just, because of the nature of the neighborhood, and I use nature that way too, it blocks that lighting. We started the front porch, the lights on campaign to give folks the LED lights with a solar cell screw-in insert for their porch lights, so that it goes on at dusk and off at dawn. So you don't even have to think about turning that on. So I hope we can get more of those out, because I agree, if we can
Yeah.
get more lights on the streets, just
Right.
on a pedestrian level, it's really, really helpful for the community.
Totally would agree, because I'm not normally an anxious person. I've grew up in my, for gosh sakes, my mom's best friends were all in the housing authority, so that's where I was playing as a child. So do not get concerned walking anywhere, and even sometimes I think twice now at coming out of any of the health centers, but I do have to agree, Amy, sometimes it just feels a little dim. And then if you can't quite see where you're walking, I've actually tripped a few times. So I think between the lighting and the sidewalks, I'd prefer to walk in the street, which is not a good thing either, but
Amy, how extensive was that porch lighting program?
Well, pre-COVID, it was amazing. We handed out easily 200 lights at a few events, and then COVID hit, so we didn't have an opportunity to get them out, because we were really just showing up at events and having people sign up. It was zero cost. We were just documenting where they were going so we could keep track. And so hopefully, as we move into more events, and obviously the farmers market starting, we'll have that opportunity to bring that back again, and get more of them out. It was, pretty much anybody that we approached said yes. And it's a really great program.
So it was really a random scattering of where the lights would be, not like a focus on one particular area, that you get a feel for what it really did if you had a high percentage of people in that area.
Yeah, so
seems like an interesting program to me.
We took a large map, and anytime that somebody signed up for it, we had them put a sticker on their house so we could have a visual map of it. And it was really cool. And one of the reasons we wanted to do that then is to see, okay, this area here needs to be hit. We need to go in and get to more neighbors in that area too, or, just see if people are keeping their lights on too. So that was part of that map process as well. So I hope we can bring that back.
Is that something that maybe we could follow up on, and or were there drive-bys, like, I don't know if that sounds terrible, but like at night to see if it
like a before and after kind of.
Yeah, we could absolutely do that. I've got the map. It would be interesting to see like if it's been essentially 3 years since we kicked that off, and how that's going too. The LED bulbs should last, I think, roughly about 5 years based on estimate runtime for them. So at least 5.
Just as with that timing range, we were just commenting, my front porch lights and the light by our garage, same thing. Our neighborhood is very dark, and we put in the LEDs and we just leave them on 24/7 because then you're not remembering. And we're like, it's been 5 years since at least 5 years since these bulbs have just been running nonstop. And, with those bulbs, the cost is not, just better off having it bright. But seems like to me too, I mean, always something like this, there's a cost. There's a cost for going door to door and saying, look at this great light here, but you almost wonder if it could not be some sort of community initiative to, go block by block and knock on doors and say, hey, your neighbor has this and this is free and we can, you can put it up and it's,
Yeah.
For sure.
Do we know, Adam, like on the target sites, 7th Street and Bushkill and
Yeah.
what is the lighting situation? I mean, I haven't been there after dark.
Yeah, I think I know at North Union Street, they improved the lighting over the last couple of years, and residents have noted that it's a lot better than it was previously. I think there's still issues at Elm Street with it being dark, and not sure about the area around the Bushkill house. But we do have some survey data on that, so we can look into it a little bit more. Well, we only have about 5 minutes left. I don't want to keep you guys too long, but I wanted to see if anyone had any comments on any of these other top strategies that were identified. We'll have more time to hit this stuff at our next meeting in March, but just wanted to open it up for thoughts on either additional foot patrols, promotion of the West Ward as a safe community, or a walkability survey and sidewalk improvements. If anybody wants to jump in on any of those topics.
So I will just, if I can, I sit on the channel 39 community board. And as part of that, they do, like community surveys of community members. And we did one right before the pandemic. We were doing these community conversations, and the walkability survey and sidewalk improvements, interestingly enough, that came up at like 2 or 3, if my memory serves me correctly, conversations as priorities for community members. And the most notable that I remember was like in South Bethlehem as well, as one that was, I want to say, what might have been in Easton as well too. I just can't remember which one of them off the top of my head, that people felt that it would have been improving their quality of life and access to things, especially.
I think we lost you there, Melissa, but point well taken. I think that's something that we've heard often as well, about improving the sidewalks and the walkability and the infrastructure. So Andrea, did you have a thought on that?
Yes, I want to be respectful of everyone's time. I know that we're about at the end of our time, but I wanted to bring attention to the Downtown Ambassador Program. I think that's its name. I think that I have heard that it has been very successful downtown, and it's they are like official employees of, I am not sure if they are of the JTP or of the city, but they walk as kind of like eyes on the street, and they are also like available to helping people, like, I don't know, like if they see a senior person trying to cross the street, they will help them crossing the street. So I feel like perhaps if we could approach, instead of having like police foot patrols, perhaps expanding something like the ambassador program to these areas where they're like the people actually live, and kind of like similar to crossing guards during the school year. and just having like people posted there, like eyes on the street, and also like available and trained to help if they see something or anyone like needing help at the time.
Mhm.
You know, do those investors, are they also doing like cleanup too, or is that a different program?
Yeah, so they are, the program is through Block by Block. It's a contracted service that GEDP has with them. So they do clean, safe, and hospitality. So they are, you know, they follow, I don't want to say, they have a very set plan in how they approach streets and corridors and corners. So they do a lot of cleaning. They talk to a lot of people. So any of that relationship building. And then they're also eyes and ears. So they're unarmed, but they are radioed into police. So if there is a situation that warrants a call to police, they can get that done quickly. We've worked with them to expand into the West Ward. They initially went up Walnut Street around the courthouse area, and then down both Ferry, Lehigh, and Washington Street to 9th Street. They are now modifying that a little bit to move on to Northampton Street. So from 6th Street to 13th Street, they'll be on Northampton. They are looking at keeping Walnut Street, but as a secondary territory. I will tell you, it's a lot of man hours, and we fund them partially through our NPP funds and also some dollars that the city gives us. But it's a big neighborhood. So for them to be everywhere and do all the things that they're supposed to do, I don't want to say it's impossible, but it's a financial, a very large financial cost to make something like that happen. So, you know, and one of the pieces is that they continue to maintain, because you can't just kind of do it as a buckshot sort of program and go into one area for a week and then move on to the next. So it really needs to be a consistent program. And they've tried to target areas that police have thought are good areas for them to be in, and also where they complement things that we're doing. So part of the move to Northampton Street has really been now, because of the relationship we have with the housing authority, that's been very positive, with starting a farmer's market on 12th Street with working with Pax and OSA. So they are trying to be more present on Northampton Street. So doing those things like being there when the kids are going to school or coming home from school, when people are out and walking around, going to football games, that sort of thing. Those are all like really important pieces for them. And then also, because it's a gateway, making sure Northampton Street is clean. That's a really big piece. So they will clean up sidewalks and along curb edges. They don't go on to individual properties, but if there are properties that need maybe some code attention, they can definitely get into our codes department very quickly too.
Yeah, I was just in downtown Easton on Saturday and saw them, and I thought, you know, one of my frustrations sometimes when you go into Bethlehem, like Main Street of Bethlehem, it's like a mess half the time. Like the leaves aren't cleaned up, the trash cans are overflowing. But I also think in neighborhoods, having a neighborhood appear clean and well kept just breeds, you know, better behavior and safety and feelings of safety. And while I definitely think more foot patrols, I mean, that's a huge cost too to the police department. And sometimes, as we know, police presence can be traumatic. You know what I mean? Like it kind of, yes, it's good because some people are like, this is great, you know, the cops are here and we feel safe. And some people are like, oh, what is, you know, so it's kind of like a balancing act, I imagine.
Yep.
You know, it's, I'm not sure how this whole process is going to come together. I know there's like 5 different working groups like us, and they're probably going through the same thing, coming up with the top 3.
Yep.
So there's going to be a lot of projects, but I think, and when I look back over Weed and Seed when they started years ago, and then when it was the West Ward partnership, and then Promise Neighborhood for a while, when we get down to looking at these, is that we need to, seems that it's got to be a balance between some short-term things and some long-term things, but mainly that it's visible, that the things that people can see, and to coin a phrase, go after the low-hanging fruit.
Yep.
And those things that aren't going to run into either political or other barriers, like some of the really good things that came up in the West Ward initiative planning the first time around. Some things around the courthouse that sounded really good, then that got knocked down.
Sure.
Around the church and the Easton Area Community Center with the part, I thought that was great. That got, thank goodness Vanderveer, it looks like we got through the school board. Amy, good going. But I think that's what we got to be careful of, that we need to show. And I like the idea of the lighting and the police and the ambassador program, of where people can see that there's people out doing something.
Yeah.
Something's happening. Because I felt so bad during some of the weed and seed type things, and people said, well, nothing's happening. What was happening? The same thing with crime. The police did a tremendous job. I mentioned this the last time around, and especially when they went after the gangs and we got rid of the tagging of buildings and that type of thing, and it made a big difference. So I think we have an opportunity here, and if say it's $50 million that comes in, and 10 to 15% for the people piece of it, 10 to 15% for the neighborhood piece of it, and the rest for the housing. That's a pretty fair amount of money. And it's not tremendous, but it gives us something to really work with. I think this is a tremendous opportunity.
Yeah, I agree 100%, Paul. Thanks for bringing that up. And those smaller changes, they'll help to build momentum for the larger initiatives that we want to do as a group. But people need to be able to see the tangible results. So yeah, we agree with that 100%. So we are 5 minutes over. Just want to thank everybody again for coming and sharing your thoughts. We're going to continue this discussion in March at our third meeting, and we'll really get down into some of the details of these projects. We also have 3 more working groups that are meeting over the next 2 days. We have business and housing this afternoon at 3:30. If you're interested, let me know. We'll put you on the list. Andrea and Amy are actually hosting 2 meetings in person tomorrow: transportation and open space, and art, history, and culture. So if you're interested in either of those topics, let us know as well. We'll share out this recording as well as the notes in the next week or so, once everything's compiled, and we'll have it on the website. So thank you again for being here. We appreciate the awesome conversation, and enjoy the rest of your week.
Thanks, everybody. Great seeing you.
Sure.
Have a nice day. Bye-bye.